Okay, I want to welcome everybody here this morning to the Utah Dental Power Play, turning legend. Tracy's a legend now, okay? Turning legislation into practice success. And I'll be the host. This is really exciting for me because I've been a host many times for the UDA, but this is the first time where I've actually been able to introduce the most wonderful speaker you will ever have in your life. Tracy Thorup. She's my wife, in case you guys didn't know that. And I'm excited for you to hear her. I'm going to hurry and there's so many stories, they say tell a story when you introduce, but I want to just bypass all that stuff. I can't wait for you to hear from her. I'm so grateful for those of you who are here. For those who are not here, they're going to be missing out because we literally met with 12 dentists and 4 front office team members just this past week on Monday. And not one of them is a member of the Utah Dental Association, American Dental Association. Not one of them knew anything about the Utah laws we've been passing, and they've been writing off thousands and thousands of dollars between their 4 practices because they don't know the law. So that's why I'm excited for all of you to be here. Tracy has worked super hard. She has been the writer, the author of the bills that have gone to Capitol Hill. She has worked with Representative Jim Dunnigan. We have had the support, she has had the support of the Utah Dental Association, and that's what associations are for. And that's what I explained to those 12 dentists. You need to join. Love, hate the associations. I don't care. But without an association, without the support of our executive director, and I'll just say the UDA team, we could not do what we do as easily as we have done it. And that's what associations are about. And Utah, and I know I'm stealing your thunder,
No, go for it.
Utah leads the way in insurance reform legislation. There is no other state that is even close to what we've done for all of you. And I hope that you pick up on this stuff. Write down your questions. Tracy is going to take questions after the presentation, so please write them down so that she gets through the entire thing. And fire away. There's no question that should not be asked or how to apply if you miss something. Without further ado, and I have to unclip this mic, Tracy Thorup is absolutely, not because she's my wife, but because she's amazing. She has multiple business degrees, digital marketing, some other marketing degree, I can't remember, bachelor's in science, and an MBA from BYU. Thank you very much. Yes, thank you. Thank you very much. Very good. Very good. And so, if you're a University of Utah grad, I still strongly suggest that you listen to her very, very closely, take good notes. And without further ado, my sweetheart and partner, Tracy Thorup.
All right, so thank you. I was laughing because we knew that it was 8:30 in the morning on a Friday, so we were laughing going, well, this is the perfect time to have everybody show up, right, and learn about legislation. So hopefully you're awake. I wanted to say a couple of things before we moved forward with the actual training itself, because you know how you start to write something, and I don't want to digress, so I do have speaker notes here. Because there are some points that I really want to push out, but I want to make sure that I emphasize a few things. Number one, at the end of this training, you're going to have flyers that you will receive at the end, and it's going to show all the laws. It's going to show what the law's name is, how to find it, some excerpts from it, and what it means, and how to apply it in your office. So we've got a whole flyer for you ready to go. The second thing is, before you leave, hopefully, if you're still here, each of you will be active participants in moving forward some legislation that we're working on this year. So I'm going to depend on you to do something for me at the end of this deal. Now, we were going to go to Lobby Day next week on Friday and really talk about this legislation and encourage you to go to your local representative or your senator. And unfortunately, we're not going to be attending that next week. So this is really important, again, that you're here. And if you know of anybody who also can help support this, bring them by our booth at the end, and we'll make sure to get that QR code ready for whoever else needs to do this as well. In my practice, my business, we really like to focus on the acronym ACE. We are advocates, Now we have to use the word consultant, and I kind of choke up a little bit on that word because it's not my favorite. We advocate for you. That means we get on those three-way phone calls and yell at insurance companies with your team members and you, if you're in the front. We help you with making sure that you are billing correctly, but also ethically. That's a big deal for me. And I love the fact that we have the Utah Dental Association here because they've been there helping us and standing up for us and being a really strong force also to join with them. We focus on community, which we'll be talking about as well. The fact, again, that you're here at the dental convention supporting each other. And I was walking around this morning at all the different booths, and it's funny because we'll have clients that'll come up and give us hugs that we haven't seen since last year. We have other vendors that you might be working with that you never get to see often. And so that connection is really important. And that's why I love the fact that we're still able to have these wonderful conventions here. And it was great seeing an increase in attendance this year as well. The last thing that we really focus on is education. On these social media sites, on air, we'll sometimes reach out and ask for advice running a dental business and how do we do this? And sometimes we're not getting the right information from people. And so when we start giving information, I want you to know that we ground it in fact. I like to cite my source a lot so that you can see that we're doing our research in it. And if I don't know the answer, I will never tell you I do. I'll try to find the answer for you. So we don't know everything. We're learning every single day. Any of our clients here right now, are you here? Stand up if you are. Clients. Please stand up. There's a reason, I promise. Okay. I want you guys to all realize that these people right here are why we're able to pass legislation. Legislation costs money. And when you go through training, tuition is some of those portions of tuitions go towards these powerful laws. Utah Dental Association leaders that are here, they're here because they support all of you and they know that we're trying to make changes here. Now, Utah is the second to lowest, if not the lowest, reimbursed in the nation. And that's not something that we should be proud of. But I want you to think about it this way. We get offices from all over the nation now. They fly in to see us. And we get California, and they just beat their chest. We make so much more money than you guys. Guess what? They can't charge for half the stuff they do. Delta, specifically, likes to turn around and bundle everything, right? We know that. So they might say that they have really high reimbursement rates, but they can't bill for much. We actually, when we implement the laws and know what we need to do, and we bill correctly, according to the American Dental Association, we can be profitable. But we have to know these things, right? We need to be empowered about it. So I'm going to talk from there. I'm going to try and stay in this area again so you can hear what I'm saying. But we'll move forward and we'll try to go fairly quickly. So the first thing I want you to do is stop waiting and start acting in your practice. We talk a lot about how somebody needs to make a change. We have things for you to do starting Monday, okay? So I'm going to start with a story about an office manager that was in Idaho. She'd gone through training and she kind of was a little begrudgingly doing it. She knew everything. She'd been in dental forever. And so she was kind of curious, but again, she thought, well, if I learn a couple things, then it's not a big deal. I'll take it with me. But then the training hit and she learned state laws. She learned contracts. She learned behind the scenes realties of running a dental practice. And what the difference is between what the EOB says and what the law allows. This is something that we're going to start talking about. So all of a sudden she realizes that most offices don't realize that she wasn't just stuck in her profession, she was overwhelmed. She didn't know when she should be billing for something or when she needs to push back versus write something off. So she went back to her practice and didn't just do better. She actually changed the trajectory of her practice. And I really was hoping she'd be here this week. But again, she's Idaho, so she didn't make it down here. She helped the office thrive, but then she did something bigger. Now, this is an office manager, mind you. She went to her local association. She went to representatives. She went to Delta Dental, and she pushed back. And because she took the initiative to get all these people in the group together in the same room. And yes, Rob and I were there. They tried to kick us out, by the way. But we made it in. Because of that moment that she had created, Delta Dental had to change a fairly strong policy that they had against the dentists. It was pretty neat to watch because, again, we think that we can't do these things without a lot of help. And we tend to look to other people when we realize we can do this on our own as long as we surround ourselves with people who feel the same way. And so a lot of times I'll hear people say, why doesn't my association do anything for me? They do stuff here. This is the coolest state to live in, and you're going to experience that. So today's about turning frustration into clarity and clarity into action. So by the end of this presentation, I want you to know exactly what you need to do on Monday, and we're going to help with that. So if you've ever felt like insurance rules are designed to confuse you, you are not crazy. The manipulative verbiage on the EOBs alone are the reason why there's a lot of frustration and strife between the doctor-patient relationship, and we are going to address that as well. And if you've ever looked at the EOB and thought, well, that can't be right, you're paying attention, all right? So I'm going to go ahead and skip through the rest of it. We're going to move forward here. But my goal is that you leave again here empowered. Whether or not we work together in the future, I just want you to move forward and know that you know what you're doing. So we've got a little misinformation in dentistry to start with. We've been trained to think that billing fairly for the services we provide is called nickeling and diming. And we've heard it. I've heard it. But we've been trained to bundle services so the treatment plan looks better. But patients don't judge care by how few line items we have. Patients will look at the bottom line, and then they're going to say, well, what do I get for the money? So that's when they start looking through your line items. Patients feel nickeled and dimed when you chase after them after services are rendered for more money because the EOB is misrepresenting what their patient portion is, or insurance pays less than you estimated. And so when you go after the patient for more money after collecting at their time of service, even though we say it's just an estimate, right? We've been trained to tell them that. That's what patients feel is nickeling and diming. And so we need to make sure that we have this knowledge so that we can help our treatment plans be a little bit more accurate so that we're less likely going to do that. All right. So most conflict is inaccurate estimating and surprise billing. It's not clear line items. So today, one of the things that you're going to hear from me is this: to be accurate is kind. Transparency is protection. And it's not just protection with your patients, it's with you as well. When you are extremely transparent, this is protecting your practice. And Utah law is finally starting to match that reality. So we're going to go through a roadmap of some of these laws that we've passed, and this is whether we've been directly involved in it or if it's been somebody else, but they're very, very strong laws. In 2017, we're going to talk about the non-covered law that was passed and what it means. 2021, we've got the bundling protections law, but this is called the network leasing, downcoding, and bundling protections law. So we're going to talk about all those things. 2025, we have House Bill 23 on timely filing, and then we move forward to 4 additional laws that were passed in 2025, one of them effective January. And then we're going to look at 2026 and what we have planned to put a little bow on everything, which is really great. And again, I want you to think, what am I going to do on Monday with this information? So we're going to start with Senate Bill 44. This is in 2017. It's also known as Christensen's Law. So there was a Senator Christensen. He's now retired. He's a pediatric dentist. And he realized that the problem we're having is these insurance companies were not covering services, but yet they were regulating them. They were dropping the fee and forcing you to go with the lower fee, or they were trying to bundle that service. You know, anything that they can do to make themselves look really great at your cost. So raise your hand. Who's heard inclusive? Come on, we've all heard it, right? On the EOBs especially, or even from your colleagues. Oh, that's included. Even over the phone, that's inclusive. And sometimes when you hear that from an insurance company, you felt stuck. Like, okay, well, that's something I signed. I signed a contract. But here's the core idea in plain English. If a service is not covered by the plan, they can't regulate it. They can't force you to drop the fee. They cannot tell you it's inclusive. It's not covered, okay? So how do we anticipate that with our patients, right? We need to make sure that our treatment plans show that that service that you anticipate performing is not covered and it's fully the patient's responsibility. Now, do you wait for the EOB to come back showing inclusive, or do you treat it like fluoride? And I'm hoping that you anticipate those non-covered codes and you collect in full at the time of service. Now, through the training, I'll always say, what if you're wrong? So what if you're wrong? What if you collect from the patient and it turns out to be a covered service? You thought it wasn't, just like fluoride. What happens? You refund the patient, which makes you look like a hero, by the way. Hey, guess what? I fought with your insurance. I got them to pay for that code. You're welcome. I have a refund check for you. Do you want a credit on your account to put towards that other service? Now let's look at the other way. I think it might be covered. I don't collect from the patient. And then it comes back. What does the EOB say? Oh, that's inclusive. They like to use that word. They love to hide behind that word because it alludes that we should be writing it off. They are embarrassed to admit they don't cover that code. We're going to talk about that at the end of this lecture. So if I'm wrong in that situation and I don't collect from the patient, now I have to call the patient up. That is the most awkward conversation. We all know that. Telling the patient that they owe more money after I collected. And what is the patient going to do? They're going to go to the EOB, they're going to see the word inclusive, and they're going to have a battle. So I'm going to encourage you to try to anticipate those non-covered codes and treatment plan them to be 100% the patient's portion and hope that you're wrong. This is a good thing. I want you to be the hero in this story. I don't want you to be the villain doctor or doctor staff that goes after the patient for more money after the fact, okay? So, the main thing we need to do when insurance companies push back and say something's inclusive is say, is it covered? Well, it doesn't matter. You signed a contract. No. Is it covered? You need to get them to admit that the code is not covered. And when you do, get a reference number. Get a reference number, and there's a reason behind it, okay? So what does this look like in your office? I'm going to give you another example because we know this is going to happen, okay? Oh, this is a great example of a non-covered code. This is one that actually some people get a little nervous around. This 9211 code. What is that code? Oh, it's scary. It's a regional block code. Now, we're not going to talk specifics about it, but you do need to know that regional block is generally not covered. Having said that, I've gotten paid actually this week 3 times by insurance companies for this code. Okay, so generally not covered. All right, so on the left side, you're going to see the amount charged of $47 for this code, and it says your contracted amount was $37 and change. Now, if you look at the rest of it, it's all zero. Now, when I called this insurance company, you can see a little note at the bottom. It says we consider the service to be inclusive of the procedure. It's pretty common language in these EOBs. But when I called this insurance company up directly and I asked them if that code was covered under the patient's plan, guess what they said? No. But we kind of think it should be included. They can't regulate it. Now, thankfully, I had already collected from the patient and asked me if the patient called me and asked about it. They never do. It's when you go after them for money, and there are certain circumstances. But we're going to pretend that Karen calls, right? So we create those lists in our practice management system. We change the insurance to 0, estimating it to be 0 generally. We collect at the time of service. You can see how I emphasize that. And then I usually will ignore the EOB because we know that generally speaking, these EOBs are not correct. Now, what you do need to understand with EOBs is most of these insurance companies have standardized their EOBs across state lines, which means they're not acknowledging some of the legislation in our state because it's not effective in other states. So that's why I say most of these EOBs are incorrect, but you do need to just kind of watch them, right? If it shows that it's covered, if they pay on something, make the proper adjustments. But then Karen does call, right? There she is, and she's mad. My EOB says you have to do this. We have those patients. So here's what you do. Number 1, your patient has called expressing concern that something's wrong. The worst thing you can do is get defensive. I love the fact that she's concerned and she's trusting me to explain it to her. Most of the time, I can have a good conversation with these patients. So here's what I'm going to say. And you are welcome, by the way, to take pictures. Karen, thank you for calling. By the way, if there are any Karens in here or Kens, I apologize in advance. That's what I'm using, okay? So Karen, thank you for calling. I always want you to call when you have concerns. Your insurance company is embarrassed that they don't cover that code. And instead of admitting it to you, they try to use the word inclusive to allude that we should be writing off that non-covered code, which is actually illegal in our state, Karen. We already knew that they were going to do that, which is why we estimated that at the time of, that it would be your portion at the time of service. Now, if Karen continues, which by the way is rare, they just want clarification, okay? But if this patient continues to push you, this is where you do make a phone call to the insurance companies. You're going to call them and say, well, first of all, again, talk to Karen. Karen, I'm going to call your insurance company, see what's going on with them, why they're acting like this. So you're going to call them and you're going to say, hey, this is Tracy. I'm calling from Thorup Dental. I just need to verify benefits. Well, what's the date of service? Nope, no date of service. The reason for that is if I gave them a date of service, they're going to look at the EOB and they're just going to read the verbiage at the bottom. They're not going to help me with this. But if I'm verifying insurance, I'm going to get a breakdown of services, that frequencies, percentages, and then I'm going to ask them, can I check and see if certain codes are covered under this patient's plan? Yeah, sure, what are the codes? You can only give me 5, right? They usually limit it. So I'm going to list the codes, random codes, and they're going to say covered, not covered, covered, not covered. I'm going to slide that code in question in that list. And guess what they're likely going to tell me? It's not covered. Great, thank you. And just to confirm, services that are not covered under the patient's plan, are they the patient's responsibility? And they're going to say, yes, they are. Thank you so much. Can I get a reference number, please, and your name? Now I get to call Karen back armed with information. So I'm going to call Karen, and I'm going to say, Karen, I just called your insurance company, and I have a reference number for you. Do you have a pen handy? Write this down, please. I'm going to give her her reference number, and I'm going to say, Karen, I just spoke with this agent about this code specifically, and that agent did confirm, yes, this is a non-covered code, and it is your responsibility. Hey, Karen, I'm sorry they lied to you. But this is something that we experience a lot with your insurance company, and it's likely going to happen again. Now, Karen, if she's a right fighter, is going to call them up and she's going to give them a reference number. She's going to give them the code and she's going to say, I was told it's not covered and I'm responsible. Is that correct? Now, the agent has a transcript that they're going to be referencing to, and they're going to read exactly that information. Verified with the doctor that this code is not covered, and verified with the doctor that this code is the patient's responsibility. Guess what I did with that phone call? I told Karen a couple of things. Number one, thank you for calling me. Again, I do want to thank her for that. But I also told her that I know more than she does. I know more than the EOB alludes to. The EOB lied to you, Karen, and they're gonna lie to you again in the future, so please don't make me do this again. Right? So I'm kind of setting her straight. Now, what if I were doing something really nice and I say, you know what, I'm just going to write it off this time because I'm being nice. What did Karen learn during this time? She learned that if she pushes back and uses her EOB against me, I'm going to buckle. She didn't realize that I'm doing something nice. She's thinking that she caught me with something. So I want you to realize that there are times where you should be making those phone calls and other times where you shouldn't. But when the patient's expressing concern, this is the time to do it. All right. Now let's look at this one. The insurance companies are getting frustrated because about 46, 47 states now have a non-covered law. So they have to figure out, how do I not get the patient upset by not covering this thing, but how do I get out of paying for it? Okay, so it is covered, but if done on the same day as something else, it's going to be inclusive and not billable. Who's heard that one? Can somebody yell out an example? Build-ups, there's one. What's another one? Yell it out. FMX, that's a good one. Okay, what else? Pulp caps on fillings. Do you guys, this is the weirdest thing for me. Pulp caps, if done on the same day as restorations, are considered inclusive and not billable. When else would you do a pulp cap? Can you tell me that? So when are they going to pay for it? That's interesting, isn't it? Huh. Okay, so I'm going to give an example here. House Bill 359 was the first time we really said enough is enough, and we moved forward with legislation. So that's when Rob and I got involved. We run a dental practice as well. We see the verbiage there. But what was frustrating to me is people were calling us saying, what's going on? What are you doing about this? And I'm like, nothing. I don't know. So what do? I go to the source. I went to the American Dental Association and said, I'm struggling here. Do you have any advice or insights with this? And they said, until it's changed on a state level, there's nothing that can be done. You signed a contract. All the things that we hear. And so I'm fuming because I know this stuff. Again, I feel your pain. And so I went to Rob and said, Rob, we've got to do something about this. And thankfully, we got involved with the Utah Dental Association, connected with a lobbyist for the first time, and really fought the fight. Now, we knew that the insurance companies were going to try and say that they bundle to protect the patients from having to pay money. Well, how else could they protect the patients? By paying for it, right? And so it was very frustrating to hear that they were trying to make it out like we were mean, horrible people by asking to be paid for the services that we provide. So we counteracted it, and we showed them all the different ways that bundling hurts patients. And it was amazing because I don't think they expected that. So insurance companies would call services covered and then find a reason not to pay. So there's your bundling. Now, the American Dental Association says claims bundling is the systematic combining of distinct dental procedures to limit a planned benefit. So when you take a build-up, CDT code, and a crown, and you combine them. When you take a bite wing and pano and combine them and change them to a full mouth series. That example is what the ADA used as an example of bundling. The ADA continued by saying, the ADA considers bundling to be potentially fraudulent. And guess what we did? We won with that one. Because that's a pretty powerful statement, isn't it? But the insurance companies have changed it. You're bundling. You're unbundling. That's bad. You're unbundling. How dare you? And they point fingers and act accusatory towards us when all we're trying to do, again, is line item the services that we provide. The ADA says, according to their code of ethics, to code for what you do. That does not mean put it in if insurance covers it. If you do it, you code it. That's in their code of ethics. So we have to understand that it protects our practice when we document things appropriately. And secondly, we deserve to get paid for those services. Who told us we didn't? And then we complain that we don't get paid enough, but then we write things off because we feel bad. Now here's what's really great. We passed this law stating that the insurance companies are allowed to bundle. I didn't want to, but we have to compromise, right? So they're allowed to bundle, but they cannot force us to write off bundled services as a result. Again, we have to anticipate those things. Gingivectomies, pulp caps. And by the way, with pulp caps, you better prove that you needed it. I know some doctors like to pulp cap everything, but that's how we got in this mess to begin with. The insurance companies start seeing a certain code being billed more than usual, they're going to try and regulate that code. So prove the need for treatment, please, please, please. And then I'm comfortable with you billing for that code. But guess who has to pay? It doesn't feel good, but the patient pays. Now I'm going to show you a great example of what happens when the patients start paying for services that should be covered under the plan though. And it definitely is a cool thing that happens. I think you can anticipate that. Okay? So the great news is when patients or their employer group understand what low premiums mean, because that's how we're getting low reimbursements. You guys need to understand that these insurance companies are competing with each other with a standardized product. They're all selling the same stuff. Deductibles, alternate benefits, right, or downgrades, $1,000, $1,500 max, missing tooth clauses. They're all the same. They can talk to each other about coverage, just not fees. So if you're selling a product that's exactly the same as the person down the street, how are you going to compete with each other? By lowering your premiums. So if you increase your premiums to cover more things, the patients don't see the value in that. What are they going to do? They're going to go to a different insurance company. We've got to change the mindset of the employer groups and the patient to realize that if they want more things covered, they have to make that decision to pay higher premiums and not be forced into it. Okay? But this is how it gets really fun and changes happen. So here's an example of, let's see, inclusive. There you go, 4212. Anybody know that code? There's your gingivectomy, right? So they consider it to be inclusive of a crown. The question is this: can you do a crown without a gingivectomy? Do you have to do a gingivectomy with every crown? If it is not required, is an additional service. There's a reason why it's a separate code. Now, this is a great example, again, of bundling, and they're going to say, well, we cover it, but only for perio issues, not in conjunction with crowns. So this is a situation where team members, you need to acknowledge that this is something that the patient might have to pay for. In our office, we will treatment plan, telling the patient we might have to do it, and so we're going to put it in the treatment plan. We'll estimate it to be their portion if we have to do it. And the great news is, if we don't have to, we get to celebrate with the patient and save them some money. So I always want to give them the worst case scenario in these treatment plans and remove the codes when we don't do them. But estimate insurance to be 0, okay? So there's how you apply it in your office. You're going to create a list of covered codes that they say they cover, but they bundle, and we know they're going to fight us on, okay? In your software, not PMS, your practice management software, you're going to change your estimated insurance to 0, and you're going to treatment plan the patient showing 100% of your portion. Again, the patients look at the bottom line and what am I getting for the money? That's what we all do. Well, how much is this going to cost me? Then what are the details? Collect from the patient at the time of service. You've just won half the battle, if not more, by doing that. Send the service to the insurance company, but expect the EOB to likely come back saying this is inclusive and not billable to the patient. Utah, again, was the first state in the nation to pass this law. Tennessee copied our law in 2023. Washington has tried to copy their version of our law, and it's starting to take effect. And this is what we love. You start it in one state and we copy in others. It's fantastic. But as of right now, we're not going to see much of that result outside of our state. So expect that inclusive language in there. You get the Karen call. She's back on the phone. What do? Very similar things to what we encouraged you to do with the non-covered service law, okay? Karen, thank you for calling, okay? I'm gonna tell you my little verbiage again. Karen, thank you for calling. I want you to call when you're concerned about things. Now, your insurance company is doing what's called bundling, which means they're combining separate procedures to try to get out of paying for it. I know they said it was covered to you, but it's their way of getting out of it. It's a loophole that they've created. Now, bundling and forcing write-offs as a result is illegal in our state. We knew they were going to try and do this, and that's why we created a treatment plan to show that it's your portion. I'm sorry they lied to you. Most of the time, your patients will say, thank you so much for clarifying, and they hang up. The same thing happens if you get that patient saying, no, my EOB says you have to listen. You make the phone call. You ask them why they're telling you to write off that service. And a lot of times we notice that they're changing it to not covered. But again, let them know that they're violating state law by forcing you to write off that service. Now, here's the thing. Most of those plans will not change your EOB. They don't want to be bothered with changing the EOB language. But if you can get the person on the other line to acknowledge that the patient's responsible because of the law, get a reference number and call the patient back with that information. They will repeat the information to the patient. So at least you have something proving your statement, and the insurance company has to back you up with that, okay? So House Bill 359 had 3 sections to it. The first one was bundling, which we just talked about. The second section is actually on network leasing. That's when they join forces with other insurance companies or other plans, or a network leasing company adds on another insurance. So you think that you're making $100 and suddenly they're reimbursing you at $80, saying, oh yeah, we're under this plan now. So Rob and I joke, and I hope I'm not offending anybody, but we say that this law keeps the insurance companies from pimping you out without your knowledge. Okay, and that's sorry, but it's kind of a good way of saying it in a sense. We have to know when they have this intention, because we need to have the ability to choose yes or no. We need control over our practice. And so thankfully, the Utah Dental Association, because of all of you being members, were able to take this information and push back and say, we need this as well. What does it mean? Actually, I'm going to give you an example first. This is an example of a letter I just received last week. We have an insurance company that's decided to join forces with, I'm going to try and read it, it's really small here. Can anybody yell it out? Sun Life. Okay, so now I have an alert Front office team members, you are not just office managers, you're business managers. Your job now is to decide whether or not you're going to agree to this. So the first thing that you need to do when you get this letter is compare the two plans. You're going to pull one insurance company, you're going to pull the other insurance company, and you say, which one pays more? Now, if MetLife, in this case, is the main plan, and Sun Life is going to go underneath MetLife, then maybe you say yes if it accepts that higher fee. Now you get a little bit more patience, you're golden. But too often we see that it results in one plan dropping the fee to the lower of the two. And the insurance companies, when they join forces like this, they are allowed to go back and forth between the two plans whenever they want, really. This is where I don't believe we should be allowing any type of, even though it's just two plans. In my opinion, this is something we're working on in our practice. I'm separating them completely. I'm not going to allow them to play this game with me anymore. So immediately what I'm going to do is I'm going to opt out. If it works for my practice, I'm going to call them. I'm going to say, no, I'm not going to do this. And I'm going to make sure that I take a record of the dates, reference numbers, and all the details. I need to opt out, okay? The last part is downcoding. Now we're lucky in most of our states because insurance companies can downcode, but hardly ever do we see them force a write-off as a result. So my example is always going to be a posterior composite. We know most insurance companies are going to pay us for the least expensive professionally accepted treatment. So not only are they paying us for a cheap composite, you could have done it cheaper. So they're going to change that to a amalgam because you could have done the amalgam in those back teeth. Now, currently, we know that we're not supposed to write off the difference. If you do a composite and you agree to a certain fee for that composite, you collect that fee. But what's to keep them from changing their policy to force the write-off? And I don't like the fact that there's a potential. So we made sure in our state to add verbiage that states that if they downcode for any reason, we are not required to write off that difference. Okay, so team members need to realize you collect the contracted amount for the covered service. Now, composites are still covered, just not for the back teeth. So it would fall under a covered service. You need to honor the same fee that you agreed to for that service. So House Bill 359 contains sections that address the behavior of downcoding and strengthens your posture so that you can challenge it. If the plan is commercial, this is what we're going to talk about soon, and subject to Utah law, the payer doesn't get to invent a new standard after your care is delivered, okay? So here's an example of downcoding or alternate benefits you can see in here. In this EOB, the office billed out for a couple of one-surface composites, back teeth, and what did they do? You could have done it cheaper. So you can see that they added 2 extra codes down below, alternate benefits. And they're saying, yeah, $79 sounds good, but we're going to pay off of a $66 amalgam. Just remember again, they're going to pay what they need to. By the way, $50 deductible. Look, they paid $14 for that first filling. Isn't that embarrassing? But having said that, you are allowed to collect up to your full contracted fee for those composites at $79 a piece in this example. So how do you apply this in your office? Again, collect the amount that you agreed for the service. You collect the difference from the patient if you didn't estimate enough with insurance. But I'm going to give you a little tidbit here. When you are treatment planning a patient and they're brand new and you have no history of their insurance, you don't know really what they're going to cover, and they say 180/50. Team members, we all know they're not going to pay 80% of a composite filling. If I don't have a history to go to with payment histories, I can't be as accurate with what the estimated insurance is, but I do know they're going to pay less. Now, I have found that the difference between what they say and what they pay for is about 15%. So what I do in those situations is when I get a new patient coming in, and again, I have no history, I'm going to change that 80% coverage to 65% coverage. What if I'm wrong? Patient, I fought with your insurance company. I got them to pay more money. You're welcome. I have a refund check for you. I'm amazing, right? What if I'm wrong and I cover it at 80%? Now I'm chasing after them for money, right? And docs, you don't want to have to pay your team members to chase after that 15% difference. It's a pain in the butt, isn't it? So anticipate the downgrade, collect, and then reward the patient. Be the hero with that patient. Now, when I get that payment, I will go into my payment system in my ledger, in my practice management software, and I will put down how much they paid so that next time I can be even more accurate. But it's a really good way to anticipate those downgrades. All right. Karen calls. Oh, no, it's Ken this time. Again, if you're a Ken, I'm sorry. Same thing. My EOB says you have to write it off. Patient, I have certain fees that I have to agree to with your insurance company for services. I did this service. You can see on the EOB, this is what is acceptable, but your insurance company is paying for something even cheaper because they're saying I could have done it cheaper. I won't do that for you, patient. It's your responsibility. It's pretty easy to have that conversation. We usually know that those are the patients that want to take advantage. In front office team member, we've done it enough that we kind of know how to handle this one. So now we're going to jump into timely filing. This is something that Rob and I really didn't have anything directly with, but we were frustrated, and this was an oversight. So back in 2023, 2024, we were noticing certain insurance companies trying to tell us that we had 3 months to submit a claim. 3 months. So this is the problem. What if they have secondary insurance? I have to wait for primary to pay, and then I'm trying to check in and see why primary is not paying. And then they turn around and go, oh yeah, wait, I changed my insurance. They give you the wrong information at the beginning. Now I have to bill the correct insurance. It's been past 3 months. I can't collect. I have to write it off. And it's not fair to our practices when patients are not giving me the correct information and I'm chasing them for information. I know how to do my job. I want the money, right? We want to get paid. And so what we wanted to do was push back and try to get a year. I wanted a year because things happen. And we try really hard to get those payments. We check on the 30-day mark, and we check every 14 days afterwards, so every 2 weeks, to check on these claims. It's not like we don't want to. But there are things that happen in life, and we all experience those things. So who has written a service off because of timely filing? It hurts. And docs, we get embarrassed because we walk to you and say, I'm really sorry, but I have to write off $2,000 because of timely filing. It's horrible. So we pushed back and tried to do a year, and there was a compromise of 6 months. The night before the vote last year, not 2025, but 2024, somebody, we don't know who, changed it to 4 months. We don't know what happened, but it got voted on, and it stayed at 4 months. So we're fuming, right? How did this happen? Who did this? We don't know. So House Bill 23 fixed that mistake. It changed it to 6 months timely filing, and team members, if there are special circumstances where you tried and you have record keeping that show that, chances are you'll be able to push a little bit more past that time, but assume that it's 6 months. That means that you have 180 days. I don't want you to stress at, 45 days in. Just know you have some time now, but get on it. The sooner you get paid, the better it's gonna be, all right? So how to apply it? Number one, team members, you need to submit your EOBs as soon as you can. Now docs, I'm gonna point all of you out. Make sure you give us your narrative and make sure we have all the information that we can use to submit that claim. Because a lot of times offices will get frustrated with me saying, I keep yelling at the doctors. I have sticky note after sticky note on his desk saying, give me a narrative. I can't move forward without it, okay? Same day would be a perfect situation. Our team is cross-trained. Our front office is the same as our dental assistants, and our hygienists actually submit their own claims because they're not divas. I love them. They're the best. But they'll submit their own claims as well with their narratives if needed and perio charting. We've been working with Pearl actually recently for a lot of the perio stuff, just a heads up on that. I'll try to address it later, but ultimately insurance companies are using AI against us for a lot of claims. We're gonna fight fire with fire. So this is where I would definitely recommend using Pearl. Attach those to your claims, especially for perio, showing the bone loss. And then from there, submit it. Again, same day. It's very easy to do. Follow up on your claims after 30 days. The insurance companies have 30 days with a claim. So follow up at that 30-day mark. Check in on them. See what's going on. Now, if your agent says, yeah, everything looks good, you should get paid any minute, great. Start watching them. Every 2 weeks, where's my money? Where's my money? Now, we're going to talk about what you do after that time limit. But make sure you document everything. I want names, I want reference numbers, I want information. Because sometimes I'll submit a claim and it'll have the wrong payer ID information in it. If I don't call and figure it out, it's just going to hang out there. So please, please, please verify the information. Verify with the agent that everything is correct. Now, I do want to stop. And again, if you're a billing person, I'm hoping that you can take that. There's a reason why you're here. I'm saying if you're a billing person and you're learning this information, you're going to know more than most billing companies in the nation, especially the big ones. I'm going to rant a little bit. Please make sure your billing person does not say, if the EOB says write it off, I'm just going to write it off. We know the EOBs are wrong. We know that they're violating state law. You want somebody in the billing department who says, no, actually this violates House Bill 359 with bundling, and you're going to process and pay for this claim. That's your job if you're in billing, okay? So the bigger companies tend to hide behind the do whatever the EOB says. And if you are interviewing at somebody that's in billing, you need to ask them that question. What is your knowledge about the non-covered law? What is your knowledge about the bundling law? What is your knowledge about all of these laws? And how are you going to fight for my practice when it comes to this? I want you to ask that question. I'm just begging you, please, please, please make sure that that person is not writing off thousands of dollars, because I've gotten a lot of phone calls over the last month from very frustrated, tearful office managers with this experience. Okay, sorry I'm on a tangent. This is something that's just, please be informed. Do you like how I said the know-it-all third-party biller? Sorry, I was a little snarky when I was writing this one. Okay, so the other one here, we're going into 495. So House Bill 495, I was actually shocked. I thought that we were going to get a lot of fights with this law, because I had about 5 different laws I was working on. I had to kind of pull one back. Don't worry, 2026 is going to be amazing. But we're going to talk about some of the cool things. Plan limitations are not the standard of care. This is important because we started hearing from other states saying, this insurance company is saying that they cover SRP, but only if the pocket depth is 6 millimeters. But the standard's at 4, the bleeding on probing and the radiographic bone loss, but the standard's at 4. So what do we do about this? Because my contract has changed suddenly to say, if I do this scaling and root planing and it doesn't meet those standards, low standards, then I have to do it for free and I have to write off the scaling and root planing. So now we have an impossible decision to make. You either do the scaling and root planing because the patient needs it for free, or you wait until they get to 6 millimeters, and what are you risking then? Got a big fat lawsuit right there. What about those buildups? Half the tooth structure has to be missing in order for us to cover your buildups. Well, we got claims from offices saying, well, fine, if it doesn't meet their requirements, they need a buildup, but I'm not doing free dentistry. I'm not going to do a buildup. How's that for patient care? So this was a big problem, and we're starting to see that verbiage go into contracts saying, well, we're just going to watch it, and if it doesn't meet our standards, you can't charge. You all have standards of care that you are held to, and how dare they tell you that you can't get paid for those things? So the law states, first in the nation, the insurance companies cannot force you to write off services rendered due to plan limitations. I thought I was going to get attacked in a back alley somewhere when I put that in there. I didn't get any pushback, because as soon as I gave these examples, how are you going to argue that, insurance companies? Again, I teach to work with the insurance companies because our patients are highly PPO driven here in our state. But I'm not going to allow them to push us into going bankrupt. I'm going to work with them and tell them why it's important that we pass laws like this. And I'm going to fight for our patients because they deserve the care that we have to give to them. I deserve to get paid fairly. Okay, this was a big one. First state in the nation. Super cool. Can calls. My EOB says, oh, wait, what? Can calls? Or the one before? Do you see how passionate I am? I'm sorry. The insurance companies cannot force you to write off services rendered due to their plan limitations or plan requirements. So if they say it didn't meet our clinical criteria, guess what? It met mine. Yes, sir.
Does it make a difference if you're networked with a federal insurance plan versus a state plan and these laws?
I am so glad you asked that. There is a big difference. We're going to talk about federal plans, ERISA plans, and self-funded plans, and how we're going to combat that too. Okay? Currently, self-funded federal ERISA plans are not required to follow state law, and it kills me. But here's the good news. You're only at about 20%. And some of those self-funded plans or federal plans will even honor non-covered loss. And so there are times where you still can have a good fight and they buckle. But in the meantime, we are going to talk about how we're going to address that in 2026. So I'm so glad. I did not plant him. I did not pay. I'll pay you later. That's a good one. This is a great one. So the patient calls. My EOB says you did something that didn't meet their standards. This is why you document the crap out of everything. You take intraoral photos. You take x-rays. You document why it met the standard of care. I wouldn't be concerned. Okay? Your patients need to understand that your goal is to help them, to treat them, to take care of them. And so there are going to be those patients. But what's interesting is a few years back, the American Dental Association had one of their executive directors stand in front of the camera, and it's funny because you could see them reading the script, right? But it says, at no time should the EOB state that your services were not medically necessary. The ADA has that statement, but nobody's really held them accountable for those statements. And so it's easy to fight back. If you get that patient that pushes back, just call me up. We don't care if you're clients or not, okay? But applying this is the best thing you can do. You're gonna get an EOB randomly in the mail that's gonna say that that service didn't meet their clinical criteria. Once you get burned the first time, you're going to make a note of it, that this insurance company is playing games now, and they're going to try and fight paying for services. We all kind of know which insurance companies they are. Again, we have so much experience in the front desk that when we start seeing things happen over and over, we're going to try and anticipate that in the future. The next time that happens, estimate the patient portion to be 100% and hope that you're wrong, okay? Tell the patient, your insurance company doesn't like paying for this code, but it's needed. Well, I don't want to do it if insurance doesn't cover it. Then go somewhere else. We won't compromise our treatment because insurance won't cover something. By the way, we have stickers at our booth that say this treatment plan is not a suggestion. I recommend you grab that sticker. Just put it on their forehead. So patient, the standard of care that we are held to are this. Your insurance company wants us to risk a malpractice lawsuit by putting your oral health at risk, and we're not going to compromise that. We need to stop letting our patients dictate their treatment. Now, I'm all for patients having say in their treatment regimen, but if something is needed and they tell you no, now you're putting your practice at risk. And team members, forms, especially x-ray refusal forms, are not going to protect your practice. Are you going to protect the patient or are you going to protect your practice? This is where we need to make sure that we're looking at the right thing and prioritizing the right thing. Now, the previous laws were actually reinforced with House Bill 495. Back in 2002, I had no idea this existed until it was mentioned to me by the insurance commissioner. There is a timely payment clause that was passed. Have any of you received a check in the mail from insurance for like $1.32? This is from this law. It's the most ridiculous law in the world, but guess what? I still am petty and I love this law. So the insurance companies, if you submit a clean claim, everything's added to there, you did everything beautifully, the payer ID's right, the x-rays are right, narrative's in there, and it's beautiful. The insurance companies have 30 days to process your claim and pay you, okay? If they need a little bit more time, they have the ability to reach out and say, hey, we just need a little bit more. In that case, it's going to be 45 days total, so 15-day extras. That's why sometimes you'll get a letter in the mail and it says your claim's still being reviewed. It's because they know they're at that 30-day period and they just need a little bit more time to stall. We know that, right? Now, this is where it gets crazy. How much do they owe us? It is the amount due times the number of days past times 0.033%. That's why it's a little amount. But guess what? I'm still going to go after them for that $1.52 because they do that with us, don't they? So if you submitted a clean claim, you need to call it that 30-day moment either way, right? You're starting at that 30 days. And after that, when they say everything's great, do you need any extra time? Nope, we don't need any extra time. Great, start counting. Now, I've reached out to the insurance commissioner and the insurance companies saying, how are you documenting this and how am I going to hold you accountable? Believe it or not, I call them and I just ask them really weird questions like that. Now, the insurance commissioner has reached out as well, and they've said, we will track it and we will pay you back, but I don't trust them. So if you noticed an insurance company that was just stalling constantly, I would start tracking. I'd create a spreadsheet. And when am I at my 45 days? And then I start harassing them and I start counting the days. And I'm even thinking I send them an invoice somehow. I don't know, we'll figure it out. The good news is that they're pretty good about paying when they know that you know the law. So make sure you're aware of this. Virtual credit cards. Oh, I heard a ugh in the background. I hate them because we're already taking a huge hit in our reimbursement. Now I have to put it through a credit card where I'm hitting credit card fees. Now I'm getting paid less. And so guess what? I'm a paper person. I still love paper checks. I've tried EFTs, by the way. We went fully EFTs in about 2021. And I was getting insurance companies telling me they were putting money in the bank, a certain amount on a certain day, but we go to reconcile, that money's gone. And guess what happens? Oh, there was a bug in our system. Sorry, we'll reprocess it. So if you're not really good at tracking your money, docs, if you're not good at reconciling all the time, I wouldn't say do EFTs. Yeah, it might be a little easier, supposedly, to put the money in the bank, but I'm a tangible check person. By the way, 495 does state a tangible check is an acceptable form of payment. Okay? What did PEHP do? Yeah. Okay? So PEHP sent a letter out stating that if they're going to send you a check in the mail, you get a $20 fee for every check. 20 bucks. So I'm fuming, right? I made some phone calls. Guess who's not doing checks, paper check fees? PHP has backed off, okay? We're advocates for you. Okay? I experience those things too. I like my checks. Delta Dental just released a statement saying that they were going to transition to EFTs. Not in our states. A tangible check is an acceptable form of payment, okay? So I don't want you to be concerned about that also while I'm at it, pre-authorization for PEHP. You only have to get pre-authorization for crowns if they are peg laterals or for attrition, okay? Everything else, you don't have to get pre-authorization on those guys. So if you do work with PEHP, I want you to know that. So we're back to credit cards. I was calling them, oh, sorry, go ahead.
So we don't have to take the credit cards, we can call them safe to watch checks.
Correct. Correct. Oh, they hate doing checks. But you know what? At least I have a payment in front of me. And it's easier for me to do my job when I see the money right there and I know it's going into the bank. We do a check scanner in the office. It's the best thing in the whole world, okay? Best 20 bucks a month I could ever spend. Okay, so what was happening is I was calling these companies up, like Echo V Cards, right? Saying, I want to opt out of this check or this credit cards. I want a check. Oh, are you sure? It's so much better for you. No, get me out of there. And while I'm at it, who else is under this plan where I get credit cards? I want you to opt out of those guys too. Oh no, we can't do that. You have to call each time for each plan, right? And then what would happen after 3 months? They automatically re-enrolled me back into the plan, into the credit cards. So it was just constant. There was no opt-out clause. So what we did is we copied Arizona law that stated, and by the way, again, it's easier to copy state law to create it. So we copied the law saying once we opt out, you cannot opt us back in unless we give you our written consent to do so. Now, there's a couple of things we have to pay attention to. I can only opt out of Blue Cross virtual payments, Delta virtual payments. So I can't do all of them at once, which I wish I could do, but it has to be specific to each insurance, not necessarily individual plans, but just the insurance companies. So just let you know, they can no longer do it. So this is an example of our amazing team member, Amanda, with one of these guys. So we have a special file. If we receive a credit card, by the way, did you see I marked out the credit card's probably not gonna run through anyway, so whatever. But she will call them up. She will tell them, hey, we ran this card because it's there, right? We just ran it. But from here forward, any additional, we don't want any more virtual credit cards from you guys. Opt me out. You get a reference number and you file it away. If I get another dang Dentist Direct credit card in the mail, guess what I'm gonna do? I'm gonna go after them. Okay, we need to hold these people accountable if they're gonna violate the law, okay? So this is what I do recommend in that. Any questions?
Yeah, did you say for every patient, or can we do that for?
You can do it for all Dentist Direct patients, right? So it has to be a plan that we do it. Now this is really interesting because we're not really regulating insurance with this. We're regulating a third-party credit card company, so it's a little bit different with how we have to do it, okay? All right. So applying this in the office, we already talked about that. Make sure you keep record of dates, details, names, reference numbers, all the things that you need, and file it away. And then that way, if you get it again, you can go, wait a minute, I thought I did that. And then you have a record you can look through. Now, the insurance companies have to notice something first, then they have to ask you second, and then they recoup last. Let's talk about automatic recoupments. Okay? Automatic recoupments. This is when the insurance companies think they overpaid you for somebody. And instead of asking you just for a refund check, they go and steal it from another patient. You see how, team members, you know, I know. And here's the problem that they're not acknowledging. Now I have to do a series of debits and credits on different accounts, but if I credit or debit an account, I have to make a note. How am I going to reference to a completely different patient with a different name in an actual patient's chart notes? I'm violating HIPAA. So I'm struggling because I'm trying to protect myself from any type of eluded embezzlement, right? But at the same time, how do I do this without violating HIPAA? We'll figure it out, you guys. It's pretty much what we heard. So this law states, effective January 1st, if a commercial plan thinks that they overpaid you, they need to give you notice in the mail. They need to say, hey, we feel we overpaid you, we want a refund check. You have time now to fight it if you feel that it was wrong, or go to your doctor and say, I hate this insurance company, but they want their money back, right? Now I can give them a refund check, so I'm going to debit the money back into the patient's account. I'm going to reference the check number that we wrote with the date and my information. And then on top of it, by the way, it stays in that patient's account now, I'm not violating anything. On top of it, I really need you to do something. Look at that third sentence. Docs, have your team send it certified. If I were an insurance company, I'm going to be aggravated that I have to pay somebody to go open checks now and put them through the mail. I want it automated. So I'm going to lie and say I never got that. I'm just going to wait an extra 30, 60 days. Say I never received the check and auto recoup it. Because the law says this. They give you notice. You have 60 days from the date of the letter, not date of service. They tried to do that, and I was like, oh no, that's not happening. Date of the letter to write that refund check or fight it. If you do not give them payment within 60 days, then they can go in and auto recoup. So don't let them do it. Send it certified, it is worth your time. Yes, ma'am.
I had my life recently auto recouped, I don't know, it was like $4, and I called to ask why. And they had recouped from another dentist who had billed too much. This patient owed $4.
From another office.
They took it from us, and they would do nothing about it, no matter what supervisor said.
Not at all. This is where it's going to get fun because you're going to love 2026. And again, I'm glad that you guys are sticking around because at the end of this lecture, you're going to want to do what I'm going to encourage you to do. MetLife received a letter from the American Dental Association a couple of months back saying what you're doing right now is not cool. Stop it. But it was a letter. What are you going to do legally, right? So this is where we can fight that in certain circumstances if we can get our law passed this year. And I'll tell you, this is going to be amazing. Has anybody else had that where MetLife has pulled from another office? Another office? Can you imagine that? This doctor got paid too much, so therefore you're going to be punished and you guys figure it out? That's ridiculous. These insurance companies, telling you. All right, dispensing. Who here? Oh, yes. Sure. That's an insurance commissioner complaint. You go after them. Yep, go after them. So that was effective January 1st. Some offices were reaching out to me before January saying that it was being done that way. And I'm like, dang it, wait till January, because, it's kind of one of those wiggle room things. They needed time to set their systems in place. But again, you got to look at it from their perspective. They're trying to save some money. I have a strong feeling that's what's going to happen. Yeah, I can't guarantee it. Yeah, back a slide. How's that? You got it? Okay, how are we doing on time? We're doing pretty good. Okay, awesome. All right. Dispensing. Who here sells chlorhexidine or Prevident? Okay. Who here, keep your hands raised really high, really high, really high. Docs, you too. Who here has a dispensing license from Doppel? Uh-oh. This is the dumbest thing in the whole world. I want to make sure you guys know that I feel that way, but we have to protect you. In 2023, there was a law passed about dispensing practitioners. They listed these people that were being regulated. Who is not listed? Dentists. So, all of a sudden, we got phone calls again from people all over Utah saying, Doppel's in our office right now telling us that we're going to get fined $10,000 for dispensing Prevident toothpaste without a license. Is it a prescription? Yeah. Are you dispensing it? Yeah. So we actually, thankfully, to the UDA, we found out this was happening, and then we started getting the phone calls. So the UDA was the first one up there on Capitol Hill trying to fight against this. As a result, we added dentists in 2025 to the list of dispensing practitioners. There's some things that you need to do, though. And it's more of an annoyance than anything, but once it's set up, it's easy. And our team can attest to that, okay? So the rule now is they have to be packaged by a manufacturer or your supplier. So you can't just take pills and throw them in a bottle and sell them. No narcotics. Has to be a 30-day supply or less. Tell me how you're going to track that with toothpaste and mouth rinse, because as soon as you figure that out, I'll let you know and let me know. And yes, you do need a license. By the way, there's so much going on with fluoride. Fluoride currently in the law is the exception. With 30-day supplies, you can do more. But just like with any other doctor, if the patient has a 30-day supply of something and they want a refill, you either give them a script to take somewhere to the pharmacy, or they have to come back for an exam. So that's just the rules. All other dispensing practitioners have to have that rule. And because it's stupid toothpaste, we have to do the same thing. So you decide in your practice how you want to handle the beyond 30-day thing. But fluoride is an exception to that. They can just get the fluoride tablets if that's something that your office is doing. And again, there's more going on in the background with fluoride that I cannot claim knowledge of. But we do know that that's up there in the air. Okay? So what do? You get your doctor's application in. In our booth, we have a packet. Just come by, grab it. It'll give you all the information, okay? Your application for Doppel will be in that packet. There'll be a checklist for you of things you need to do to prepare, because somebody from Doppel will come to your office and do a brief inspection, and then you'll be done, okay? So I have everything ready for you. There is a fee to be a dispensing practitioner, so about $105, $102. And then 2 years later, every 2 years, you redo it for about $70, $75. It's just what you have to do, and it's better than paying a $10,000 fine, because you're giving people, these crazy toothpaste stuff. So follow the checklist and then come by. I'll give everything to you. Again, no sales involved. Just come grab it, okay? ERISA federal self-funded. So yes, not all plans follow state law. ERISA plans, we're not going to talk about what they are, but the bottom line is there's something called a demer clause. And the state cannot deem ERISA plans to be insurance companies. Because they're not deemed insurance, they don't have to listen to state law. So that's how they get around it, okay? So it walks like a duck, it talks like a duck. You have a contract that says you have to listen to them, but they can't be held accountable under anything. The federal and self-funded plans, same concept. What you need to realize is self-funded plans are pretty much like, actually Walmart is a great example of a self-funded plan. People get hired and fired all the time from that company, and HR is already up to here with paperwork. So getting people signed up for dental insurance just to turn around and offboard them and all the paperwork involved in that is too much for them with bandwidth. So what they've done is they've decided to enter an agreement with Delta Dental to take some money, put it into a separate bank account for dental, and they pay Delta Dental a fee every month or regularly in order to administer the money. So Delta gets paid either way. There's no risk with them. They get paid either way, whether it's 100 people or 1,000,000 people. Because there's no risk, they're not deemed insurance. That's how they're getting around it. And that's how they're pushing a lot of companies right now, is to push to be self-funded so that they still, again, get paid, but they don't have to worry about playing by the rules, okay? We have plans. Don't worry about it, okay? This is a good example of how you would identify these plans. If you see on your EOB on the upper left side where it's administered by an insurance company, that's going to be more likely a self-funded plan, okay? ERISAs are a little bit harder to figure out, but the bottom line with this is if you are like calling an insurance company up and you're saying you're breaking the law and you're super excited about it, because I get in that mode too, and they go, we're ERISA, you're going to go, dang it, because you have to write it off. Okay, it doesn't matter if they're violating the law. So in those cases, if they are ERISA self-funded or federal, currently what you're going to do is begrudgingly write it off. You're not going to like it, but you have to do it. Then you're going to flag that patient's account, not to punish the patient, but because I want to be accurate with my treatment plans with them. So I'm going to make sure that I don't get myself in this position with this patient again. And then you know what? You continue on with your life. Don't get upset over it. They got away with it this time. Move on, okay? Everybody else should be pretty good. All right. So what does billing correctly actually look like? I'm going to give you an example of something, and I'm hoping a couple of you will be blown away. So again, I teach code for what you do. Now, if you choose not to code for certain things because you don't want to, that's fine. Just know you can. I make sure that we bill ethically, though. I want to be very transparent with my EOBs or my treatment plans, so the patients estimate their portion to be their portion, right? What if I'm wrong? Patient, I got a refund check for you. I fought and I got more money. I want to give you an example of an EOB, and it is small, but I'm going to point out a few things here. This is an insurance company that we billed for several codes multiple times, kind of like fillings, right? And you can see it's some arrows next to certain codes. Now this plan in particular, I don't know why, but it didn't give the actual CDT code in there. But you can see service code and it says 74 and 75. It was restorative and preventative. Okay, so just let you know those codes were in there. It might even have been diagnostic, I can't remember. But either way, they categorized the services. I see $37 actually paid. I originally did 37, they agreed, and they paid. I'm seeing another 37 and they paid. 37 they paid. Then I'm seeing, what, 47 down there? 47, 47. Now they did a little adjustment down. Normally with this particular code, I see that they try to adjust it down, but then they don't pay for it. And so I ignore the downgrade, like I ignore the price difference, right? Because it's not covered. In this case, they paid for it. So because they did pay, what am I gonna do? I'm going to write off the $3.24 in there. But if you were looking at this claim, not knowing what these codes are, would you be mad at me for billing those codes? Insurance paid for them. Was I being transparent by sending those codes to insurance? What if they didn't pay for those codes? Was I unethical by billing for those codes if they didn't cover them? Does it depend on the code? If it was a service rendered, should I be documenting those codes? Do you see all the questions that we have going on here? I'm going to tell you what they are. You want to know what they are? All day, every day, my friends. Regional block anesthesia, $37 times 3. Intraoral photos to prove the need for treatment. Because these insurance companies will find any excuse to not cover our services. And if I can document it with an intraoral photo and tell the patient, this is known to be a non-covered code patient, but I would rather have you pay actually I think I'm flipping the two, $37 for an intraoral photo than the entire amount of your service. And by the way, this is only a partial claim. So there was more in there with CDT codes and so on. I love the fact that we did collect from this patient. I got an extra $253 from insurance. But at the same time, we've got to stop conditioning ourselves to give things away. We've got to stop it, because I'm going to tell you how this got paid. I guarantee you I know how this got paid. A year ago, we likely charged the patient in full for those 2 codes. I didn't want to, but I deserve to get paid for my services. And I'm protecting the patient from insurance not covering it. Patient likely went to their HR group and said, did you know they won't even cover anesthetic? Yeah, what kind of sick, twisted insurance won't cover anesthetic, right? Then the HR group went to this company and said, either you start paying for this or we're going to take our employees and go somewhere else. The insurance company might have said, well, we'll do that, but are you okay paying a little bit more in premiums? Yeah, we can do that. Great, then we'll start paying. This is how we get an increase in reimbursements, my friends. When we charge fairly for what we do and we hold the patient accountable for the services, the patient is emotionally driven to make changes with their insurance. But if I say, it's included, I don't want to charge for it, and you write it off, what change happens? Patient has no incentive to make any type of complaint whatsoever. And so again, we have to look at it from a different perspective. What if insurance didn't pay for this? Did I not deserve to get paid for those things? What's fair, what's not? And again, my job is to tell you what you can do with this information versus what you shouldn't do and should do. And ethics are a big deal for me. I want to make sure we're paid fairly, but we're not writing things off, because I can take care of my team now. We can take really great care of our patients too. So here's what's next. Now that we understand where Utah law applies and where it doesn't with these ERISA self-funded plans, we got to go to the next step because we have gaps. And the gentleman in the back mentioned it. One of them's ERISA self-funded plans, right? And federal plans. So here's what we're proposing this year. And we have a priority bill. You know what that means? That means it's getting voted on, regardless. Step number 1, if the patient lives in Utah and the services are rendered in Utah and it's a commercial plan, that plan has to listen to state law. I don't care if this is Delta Dental of Wyoming. I don't care if this is Delta Dental of Washington. If it's a commercial plan, they know what our laws are here. I can't treatment plan these patients accurately if I don't know what those laws are in other states, and I shouldn't need to know those laws. I should know these laws here. So the law will state if you are a commercial insurance, not federal ERISA, just regular insurance, and the patient lives here and has services here, you have to listen to our laws now, okay? Second thing that we need to do. Federal ERISA self-funded. In your contract with your insurance companies, most of them will say that by signing an agreement with them, you're agreeing to also accept federal ERISA self-funded plans. That's not fair, because I should have a say on whether or not I want to work with a plan that's required to follow the law. So I am recommending and proposing that the insurance companies give you the opportunity to choose. Do you want to work with our HMO plan? Check yes or no. Do you want to work with our Medicaid plan, our PPO plan, our ERISA plan? And next to those 3 different plans, it will clearly state, not required to follow state law. That way you knowingly make a decision that's best for your practice. Now you might decide, like us, there might be maybe a federal plan or maybe even a self-funded plan that we choose to opt in with and work with, but it should be our choice. We can't regulate these companies, but we should have the ability to work with them and have the choice to work with them or not. Pretty cool, huh? Okay. You're welcome. We try, right? And this is where I'm going to ask you for your help in a second here, right? LEPAT versus MEPAT. Insurance contracts state that they reimburse us for the least expensive professionally accepted treatment. And I talk a lot about this. That's why they allow you to replace your fillings every 2 to 5 years. They're kind of a baseline material. They're not going to pay you for the good stuff. But patients deserve the options to say yes or no. What if the patient's not told that there are better options to them? They're going to be upset that they're not being given that choice. And so every contract that I've seen in the state of Utah allows us to offer patients better choices, whether they're additional services that go beyond LEPAT, whether it's a technology and medications, materials. They allow us to do this, but some other states don't. And so we have to protect ourselves from other states. If we pass this law saying that they have to listen to our state law, then I need to put in legislation that we are allowed to give these patients these choices. So we actually are copying legislation in the state of Washington. I'm from Olympia, by the way, and I have plenty of beefs against the area, but this was a good one. The insurance companies cannot interfere with a separate agreement between the doctor-patient relationship outside of the plan. If your patient wants something better, if they want those beautiful cosmetic crowns or fillings or whatever it is, and they decide to enter a written agreement outside of the plan with you, no insurance company should have the ability to jump in and interfere with that. Kind of cool, huh? Yeah. Yes, sir. You're still good. In the state of Utah, you're fine. But if it's an insurance company out of the state that doesn't allow for those things to happen, that's where you're out of luck. Most of those plans are pretty good. So for example, I'm going to give you a big insurance company in the area. It starts with a D. In that actual provider handbook, it states that if there are additional services or upgrades available, but the base service is covered under the plan, the patient must sign express consent acknowledging and accepting the additional fee. And so if it's in your contract, you're golden. So even if they are federal, it's in the contract, you're still good. Yeah, so we just have to kind of watch them and ask them. And again, they've been pretty good. Oh, they try to make us confused. And I'm trying for clarifying language, can you tell? I'm trying really hard to be black and white with these things. Now here's a good one. The EOB needs to say it's not covered if it's not covered. Enough with the inclusive stuff. It's not fair to us. It's manipulating the patient. It's causing us to second guess ourselves. All I want to know, is it covered or is it not? Well, we think that even though it's not covered, it should be, no. You can say you think it should be inclusive, but I want the word not covered next to that code. I want to know it. And so there is one insurance company that's not happy with this language. They are local, they're bigger, and we're going to have a big fight on our hands with this. But I believe that we deserve, and the patients deserve, to have as much clarity as possible when it comes to their EOBs. So this is where we make a change, and this is why I'm really glad that all of you are here. Advocacy, when we advocate, is not complaining to people. We're not trying to walk around and just talk about woe is my life. It's being an active participant in change, though. And I need all of you to do something for me. It's not going to take long, I promise. But before you leave and grab your law flyer that has all the laws we talked about, you need to do something. First thing is, if you're involved with Facebook groups on proper billing, we just launched a new Facebook group called the Educated Front Office Manager. It's not my practice, my business based. We're staying out of it. But the goal for me is to have somebody be able to go into a group and say, how do I handle this claim? How should I handle this patient issue? Obviously redact the information, but I'm sick of people online either posting anonymously. I'm sorry, but if you're gonna try and post anonymously in this group, don't do it. Just reach out to me in a private DM. We need to put our names out there. The second thing is, if you're going to offer help, which I hope you do, make sure that your response is grounded in fact. You need to set your source. Because I'm seeing a lot of Facebook groups where these women are saying, oh, that's fraud. You can't do that. That's illegal. Oh, no, my dog. Oh, right? A lot of bickering on these groups, and you don't know whether it's true or not. And I'm so frustrated with that. So the goal of this group, yes, everybody here, by the way, when you go in, I'm not going to filter anybody. But after today, you're going to be answering some questions. You agree that you're going to make the right decisions with that? Yes? Dentists, you better join that group. See whether or not your office manager is complaining about you. By the way, it's one thing I'm going to tell you, please don't do. What's the average pay for an office manager in this location? Don't do that. You know, it's all based on treatment planning, maybe HR if you're comfortable with it, EOBs, you know, that kind of stuff, all right? Okay. Facebook rules, again, be professional, please. No anonymous posts are allowed. Responses have to be grounded in facts. If you say, per the ADA, I'm going to love you a lot. If you say somebody told me that somebody else told them, we're not probably going to allow that to happen, okay? Before you respond, think about these things. What does the American Dental Association say about it? What does law say about it? What does the contract say about it? I want you to be really clear with those things. And if you don't know, it's okay. But I just am sick of the misinformation, okay? From knowledge to action, your last thing before you leave. And we are actually ahead of time, so this is good. This is Representative Jim Dunnigan. He helped us with the bundling law in 2021. He helped us with the network leasing law. He helped us with the downcoding law. All of those laws for 2025, he helped us with all those too. He actually is the one that created the priority bill for the bills that we're trying to launch this year. So yes, you can choose to contribute to his campaign because he needs help. He's up for re-election this year. But what would be even nicer? Send him a letter saying thank you. This guy works tirelessly for dental offices and protecting the offices. You know what's crazy? He sells dental insurance. I was so scared when I saw this guy. I'm like, there is no way you're going to be on my side. The most fair person, and he will look from both sides. And every time we propose something, he says, let's get these insurance guys on the table. We got to make sure that we fight the battle before we go before the House and Senate. And so the way that he does it is very fair. And again, I think that just a simple thank you to him for helping with insurance reform. And you could say my practice, my business, the UDA, you know, he knows what's going on though. And the thank you goes a long way, okay? Here's the big one though. Do you guys know who your representatives and your senators are? Did you know they will never listen to me? They're not going to listen to me. They'll listen to their constituents though. So if you scan this code, what's going to happen is it's going to ask you for your zip code. You'll enter in your zip code and it's going to bring up 2 people that represent your place of where you live. In my area in South Jordan, I've got Tracy Miller and I've got, oh gosh, I can't even remember the other person. So once you scan, we're going to start an email from your phone telling them to vote yes on dental insurance reform, but you don't know what to say. I'm scared, Tracy. I gotcha. Okay? Once you figure out who your person is, and I'm going to give you a minute to do it, you're going to scan this code and it's going to redirect you to our website because we needed a landing page. That's the only reason. That landing page will have a letter for you to copy and paste right in your letter to your representative and your senator. Fill in the blanks, okay? This is a big deal. We have a few people in this room. This means a lot to have somebody tell them, you represent me, and this is what I need you to do to help me and the patients that we serve. So scan it, find your people, and then write that letter, okay? I'm gonna have this up and running in a second. I'll pop back to it, but I'm gonna say a few things at the end. Today was not about overwhelming you. This is a lot of information, and I understand that. We have flyers, again, that are just, you open them up, it has all the laws in it, how to apply them in your office. So as you leave, please take those to your office and share them. This is about clarity, though. Dental is confusing, and it's manipulative, and it's all those things for a reason. We need to stop. We need to know what the rules are. We need to fight back. The changes that you see and decide to do, start on Monday. Monday is the perfect day to start. Each of you is going to leave with a handout. It lists every law that we discussed again, what it means, how to apply it in your office. I want you to use it. I want you to keep it accessible, reference to it, pull it up, call us up for clarity. And if today raised questions or you want to talk about how it applies in certain circumstances, feel free to reach out. It's fine. Again, we don't care if you're clients or not. We've got to work together. We need to join forces, okay? At 3 o'clock today, we're going to be joining the Utah Dental Association for more advocacy information for all of you. It is a little bit later in the day, but it's from 3 to 4. They're going to also give some updates on some other legislation, hygiene, for all of you to be aware of as well. And again, it's no pressure, it's just clarity. So my closing statement for you, if today confirmed anything, it's that change does not come from just waiting for somebody to do something, right? It comes from participation, which is what, again, I want you to do before you leave, please. It's why we created our Educated Office Manager group, and it's why we pushed you all to be more active in participation with legislation. So as of today, the dental laws in the wonderful state of Utah are becoming more and more clear, and now it's your turn to apply them, my friends. All right, thank you. Thank you. All right, so any questions before you leave? We've got some time, so yeah.
My question is,
And I'll repeat the question.
with the stuff you're working on for 2026, do you guys have any kind of like social media thing where you're posting updates and things that people can do?
Yes. So what we're waiting on right now is we know this is a priority bill. The lawyers are in the middle of final verbiage for it. So as soon as that happens, we're going to pop it out. We have to play a little bit of a balancing game because it's kind of like, you know, and I don't really play cards, but you want to hide your cards a little bit until the very end. The insurance companies are aware of what we're trying to push. And so I'm trying to balance educating as many people as possible and pushing them to write their letters. You're going to see it on the Utah Dental Networking Group. A lot of times I try to post things on there. You're going to see it on our own Facebook page as well. And we are going to be sending out mass emails. Those of you who saw some things on Utah legislative reform, have you seen some emails from us saying Utah's leading change? Is there anybody from the American Dental Association here? Anybody representing the American Dental Association? It's okay, I love you. Don't worry, okay? I would have said the same thing either way, whether somebody was in the room or not. I'm frustrated right now because we are absolutely #1 with insurance reform in the nation. No other state has the laws that we have. Nobody. And it frustrates me because every time I try to reach out to tell the ADA about this, to say, listen, share the news, tell everybody about this, push for it, it's crickets. The only thing that they mentioned from last year's laws was that we participated in insurance in reform for credit cards. That is not anything compared to what we have. And it kills me because, again, we are protected in our state, but why isn't everybody else? I want other states to benefit from these things. And so if you know of anybody in other states that wants to push for legislation, we don't charge for these things. The more states that pass these laws, the better for everybody it is. So, you know, again, we're going to start spreading the word as much as possible, but we're also going to put a little bit of pressure on the American Dental Association to start advertising that Utah is a pretty cool state to live in with all of our insurance reform that we have available. But I'm hoping it's after these laws get passed. This feels like it's putting a little bow on everything, you know? Any more questions? Thoughts? Ideas? Yes?
I'm struggling opting out of, you know, when an insurance will use,
Oh yeah, the network leasing opting out.
and bouncing back and forth.
Oh yeah, so she's struggling with insurance, network leasing and opting out and how they go back and forth between certain plans, correct?
Yes.
Okay, are they telling you that you can't do it? Or are they just kind of giving you the,
They just keep
Run
telling
around.
me I need to call, because it's whoever, MetLife is the one who keeps bouncing back and forth, say. And so, but they're using
a different lower fee schedule, correct?
They're using, I can't remember.
Is it Dynamax?
No, but like a third party, what is that? To pay it.
Uh-huh. Oh, so they're using another company to
Yes.
administer the claims for them?
Yes. So they keep telling me, so then I call them and they're like, no, you gotta call MetLife, no, you gotta call.
You know what's
And-
really cool?
And no one's doing it.
Okay, so here's what we're gonna do. I don't have a direct contract with somebody with MetLife, but I have a really cool phone tree that somehow I got, wink, wink, that will direct you to the correct person. So if you do me a favor, and again, we wanna help each other. Call me up on Monday or whenever, email me, and I'll forward that information to you so you can get to the right person. And if after that, then we might even get on a three-way phone call with them to try to get to the right person. Anybody here, again, we're a community now. If you have any additional insights that might help her, please talk to her, help each other out. Teach me, okay? We'll figure it out. Yeah, okay, behind you?
I was just wondering if there's any way to, I hate how they have to spend so long on the phone waiting. It's like they intentionally slow it down,
5-hour
make
phone
it
calls.
difficult.
Uh-huh.
It'd be really great to have legislation that somehow got
Ooh,
rid of
that's a good
some of
one.
that, like the runaround or,
They try really hard to stall, don't they?
Yes.
So the main thing that you need to pay attention to is these insurance companies pay their team members, usually overseas, but they pay off of what's called average handling rate. The faster they get you off the phone, the higher they get paid. And so that's why you see hear a lot of canned responses from customer service reps. But at the same time, because they're not directly answering the questions, a lot of people will call back and it's plugging their phone lines. You're right, they do want you to just give up and not hold for as long, and they're gonna try and redirect you to their website for all the questions. All your questions can be answered online. No, they can't. So legislation-wise, they're gonna argue that it's a bandwidth issue. It's gonna cost them too much money to answer the phones in a timely manner. I don't agree with it, but that's likely gonna be the legislation. Having said that, it's worth discussing. It wouldn't be this year, but if you do me a favor, again, it's at our booth, just because I don't have everything in front of me. There's a little thing saying if you're frustrated with something with an insurance company, write it on a ticket and pop it into a little jar. It's not for me to call you and talk about anything with training. It's so that I can know what's bugging you. So I was hoping that I'd be done this year. Sounds like I'm gonna be working on stuff next year too, but maybe that would be added to it. Yeah. More thoughts? All right, yeah.
How do you deal with like timely filing and like
PEHP timely filing, is that what you're asking? Okay, so this is really interesting to me. A couple of statements were made from PEHP that I'm just confused, to be honest with you. PEHP has stated that they will honor state law when it comes to legislation, dental legislation. If that were the case, and they tell me that it's going to take 6 months to process a claim, I'm charging them a late fee. And so what I've found is, and this is just something to try, I've found that if they say, oh yeah, we're 6 months behind, I've told them, okay, so I'm going to go ahead and track timely filing and make sure I document the charge for your late payment over 6 months. Who do I talk to about that? And for some reason, my claims get paid really fast when that happens. Can you try that and just let me know with that? Now, as far as pre-authorization on the crowns with the peg laterals that we talked about and the attrition, I was told from somebody higher up in PEHP that the turnaround will be about 3 days. Let's see if that's true, okay? Try to get through their website first, and it might take you 3 days to do that, right? Okay, there was another one over here. Yeah.
So, what about, you were talking about like timely filing in the 30 days. So if you call it 30 days and they're saying, oh, well, we need another image, and you send it to them.
Then it's 30 days.
And 45 days
Yeah.
pass, and then they say, well, we have all the information we need. And then you call back at 60 days and they're like, well, we never received the information, but you have all the reference numbers and everything.
Then you can fight them. Yeah, it's a stalling. So what you can do is, so the question was, what if it's 30 days, you call them and they say, oh, we need an x-ray. So you give the x-ray. As soon as you give that x-ray, the 30 days starts all over again, okay? So just to let you know. So now you're 30 days in and they say, well, we didn't get that information, or they try to stall like that. Take advantage of the systems that have NEA attachments so you can prove that they received it. That's a big one. If they say we didn't get anything, usually that's when I'll say, okay, I need your email then. And they'll go, oh, well, I'll only give it one time. I'm like, yeah, sure. And I keep it for the future because I'm not going to do it one time. Yeah.
So the previous rep said that they received the information and then you called back 30 days later. Then the next rep said, oh, well, we never received anything.
Mm-hmm.
I said, no, because this rep with this reference number said that they received it.
Okay. And did they backpedal on that, or they just said they didn't get it?
They said they didn't get it.
Okay, so once you start noticing that they are stalling, which sounds to me like what they're doing, or the agent just doesn't want to look, they're being lazy, that is grounds for filing a complaint against them with the insurance commissioner. Now, people are a little concerned about that. They think that there's going to be retaliation if you file a complaint. They can't. If they retaliate against you for holding them accountable under law, have fun. We'll join the lawsuit with you because we're going to be in a very good place when we go after them. Yeah.
I was just feeling like the Utah State Commission, they're so helpful.
They're amazing.
So fast. And I called them the other day, just asked a question, they clarified something. And that was that. And they're just so easy to work with. Complaints go through quickly.
They really do. And you know what, this is where it's been really great, is our insurance commissioner in our state is very knowledgeable of legislation. Some states don't even have an insurance commissioner that handles complaints from providers. So again, we're blessed to have people that support us with this. And yeah, we have to sit down and sometimes educate the insurance commissioners, but they're great when it comes to protecting you and holding these insurance companies accountable in the back. Yeah.
Is there a way, and this might, I don't know if it's considered just all-inclusive, but like if you, for a certain service like a crown or root canal, if you have more advanced technology like doing same-day crowns, or with endo, we got a laser, so we do the sweeps endo protocol, laser protocol with it.
Yeah.
Is there ways to bill for that on top of it, or is that considered inclusive to?
Per the
root
American
canal?
Dental Association, it's at the doctor's discretion how to satisfy the CDT code. A decision to bill for enhancements, for example, materials, cost of gold, etc., is a business decision that is not supported by the CDT code. That means there's no code to represent those things that you're doing, those enhancements. How would you bill for an electric toothbrush? How would you do it? You create an internal code in the office. Now here's the thing. We aren't going to talk about high-tech laws. We're not going to talk about lab fees. But the insurance companies have said, listen, we're acknowledging we're not going to pay you for the best of the best. Our concern is that you're going to take advantage of the patients. So we will feel you're taking advantage of the patients if you hide lab fees in there. You say high-tech because you're not really explaining what it is. Or you sneak it in there and the patient doesn't sign anything. So you need to prove to us that you educated the patient on that better option and you gave them that option, and that they signed proper consent with refusal on the same page. If you do those things, then we're going to be perfectly fine. But if you lie or deceive the patient, we're going to have a problem and you're going to need to refund. So again, that's some cool things that we are able to do in our state, giving those patients those options. Absolutely. And then over here on this side. Yeah, no, I mean, yeah, going a little further in the back. There was somebody in the back left. Yeah? Yes.
4 quads of SRP.
4 quads of SRP absolutely can be paid by insurance companies. Specifically, Delta. You want to hear how you can get them paid?
Yes, please.
First of all, can you keep the infection on one side of the mouth if you do half of the mouth, SRP? The insurance companies assume that 17% of the patients will not return for that second half, and that's why a lot of times they'll give that verbiage to you. Delta Dental has stated that if you give the proper documentation as to why you did 4 quads, they will pay for it. Number 1, you need to explain why you're doing all 4 quads. Now, I've turned around and said, COVID, that was one, right? There was a time when that happened. Work restrictions, patient can't come back. I've even said, due to my inability to keep the infection on one side of the mouth, I've elected to do all 4 quadrants. They just want to know why, okay? The second thing they want to know is, how much time did you spend per quad? They want at least 30 minutes per quadrant. So no 1 hour or 4 quad SRPs, okay? 2 hours. The third one is you have to make the patient comfortable with anesthetic. Now, if the patient refuses anesthetic, you need to say, patient refused anesthetic, and I did it, right? So you have to make sure that you acknowledge the anesthetic used. Their first 2 claims will kick back saying, only 2 quads, only 2 quads. You have to appeal it and say, read the dang narrative, because Delta Dental's system won't read narratives. It just kicks back the response. So you've got to kick back several times and then they'll pay for it. Yes, ma'am?
I was just gonna say, I've also used that patients have dental anxiety and they pay back.
Dental anxiety, that's another one. That's a great one. Now, Blue Cross last year introduced a new program for perio patients under certain conditions where they actually will pay for more perio services. So if you are Regents members, make sure that you reach out to them asking about the details, because you might be able to get more cleanings, more of those perio patients taken care of too and paid for. Somebody else in the front? Yeah. So it's a 7-day turnaround with pre-authorization with PEHP as of right now. This is gonna be fun because I get to text somebody and say, you lied to me, you're a liar. What now?
And that was by fax.
And that was by fax, okay. This is fun for me because you see, we don't get out of our little caves and we never talk to each other about what works, what doesn't work, what our thoughts are, what our ideas are. This is the kind of stuff that just I love. Yeah.
First of all, thank you.
You're welcome. I appreciate that. Thank you. Yeah.
Okay, one of the things that frustrates me is when insurance companies do not accept attachments.
Yes.
And you know they need that x-ray.
Mm-hmm.
So tell me, how are all of you getting around that?
Okay, anybody want to give some suggestions for attachments? I'm loving you in the back. Go for it.
The DHP requires you to do it on their website. They're saying they won't accept a paper form anymore, but on their website you should be able to.
Okay, question. Have you tried to complete a claim on their website? It's insane. They ask you the same questions over and over.
Yep.
Yeah, but man, it is a headache.
You know, so what's interesting is Blue Cross went through and they said they were doing a big revamp with Availity, and it seems like it got worse. So I know that it's a known problem. We're struggling with navigating the PEHP website, but I do believe they're working on making that better as well. You're right, the frustration over NEA attachments or not accepting attachments, I tend to go and say, I'll submit the claim knowing that they need an attachment, and then I'll usually reach out about a week later, checking on status of the claim and say, hey, I know you need an attachment, what's your email? And they're like, well, you can fax it. I'm like, I'm not faxing an x-ray. I'm not gonna do it, so what's your email? And they tend to be again, the word begrudgingly is a big one during this lecture, but they tend to give it to me. But that would be another one going through the portal. Yes, ma'am?
With that one, I've also had that issue, and the standard customer service won't do it for you.
Mm-hmm.
But if you ask for their supervisor, they almost always will give you an email address because they wanted me to fax an x-ray. You're not gonna be able to see anything.
Yeah, x-rays don't work with faxes. So, and we're all on the same, this is super fun. So those of you who are contributing, I want you to stick around and make sure you establish connections with other people. Another one, yeah. Hi.
So I sent a message to PHP because I tried to do a pre-op on their website. You have to put a date of service, and
Okay.
it won't go through. I'm like, well, I don't have a date of service.
Okay, PHP pre-authorization, they're asking for a date of service, but you haven't done it yet.
So I sent them a message, and their reply, they literally said, our website is useless for electronically submitting PAs. Shocking, I know, I know. And she sent me the form and said, here's the form, fill it out, send it here or fax it.
So I'm liking this form. Do you see what I'm thinking? So PEHP gave Rihanna a form because they know that this website needs some work. How do we all get that form? Is it online on the website? Okay, so what I'm gonna hope you guys can do for me then is give me that information. And what I'm gonna do is on our website, there is a section on advocacy. And if you click on the Utah one, we're slowly building it. So, you know, it's just heads up. I wanna put something on that website for a link for you guys to be able to pull it and have it available. I try to keep pretty up to date with Utah legislation and problems. Yeah.
Sorry, we're going to do two things at once. I made my front office a PHP book and put a bunch of facts, like already filled out for them.
Uh-huh.
All they have to do is just put the date in.
Okay.
Put faxes for them and their, a list of, like, I think like 4 different forms for them to use when they have to be authorized for. So they have it all ready to go. Grab it.
Silly me. I said just give me information. Where should you be sharing that information? On our Facebook group that we just created. That would be fantastic. The resources that we can give each other is amazing. Now again, please do not share contracted fees. Please do not share what your fees are. When you start talking fees and stuff like that, you're going into collusion territory and I can't do it. But when it comes to, here's a really great phone number for provider relations for this insurance. Here's an amazing person to talk to. That's the kind of stuff that we want. Yeah.
This was a thing really fast. With PHP, if you submit a claim
Uh-huh.
on their website, on the new website, and you're wanting to use the old ID number,
Oh, ID number issues with PEHP.
and you're submitting, it will not take the old ID number on the new website, of
Yep.
course.
Make sure that you have the updated patient ID number. Again, confusion, right? Okay, I'm gonna go to the front and then the back. Yes.
So, you're in network fee, because they're telling me we're not in network and reduced to be, but they're telling me I can't use the website because I'm not in network.
But you are in network?
We are not.
Oh, you're not? Okay, so because you're not in network, you can't use their website.
Right. I mean, I can't use those tools, so then, boy, I get to mail things and then then they never got it, et cetera.
I'm so sorry. You want to hear something crazy? Again, I'm going to give credit where credit's due with certain insurance companies. PEHP 100% supports the legislation this year. And I really appreciate an insurance company that says, nope, we'll adhere to everything. We're on board with it. Let's do this. So just a little side note. Again, I don't like insurance companies. I've just learned to work with them professionally and respectfully and call them out when they need to be called out. In the back, there's one more I need to get, and then we are done. Yes, ma'am.
With PHP on their website, I have found that if you type in the old number, it'll give you the new number. It'll say that is inactive. Here's the new number. It's like a yellow highlighted pop-up, and it gives you the new M00.
Oh, that's fantastic. So apparently you put in the old PEHP number. The new one will pop up with, hey, don't use this number anymore. Use this one instead.
At least with all the ones I've looked up.
Oh, that's fantastic. Okay, good. Okay, so those of you here, again, connect with each other, talk to each other, be resources for each other. Use social media, take advantage of that with Facebook. And you have the QR code. So I'm going to go back. Does anybody still need the QR code for the letter for the insurance or the representatives? I'm going to pop back really quickly to that one. And this is the official letter. If you need your representative's information, again, all you need to do is go into Utah state legislation and it'll tell you you can look for your representative. You need 2 letters, but I have it all set for you. Again, you guys are amazing. Thank you so much, and we'll talk soon. Well, thank you.